Just give me one moment. Who are joining late, please help them out with the page numbers in the chat box. Those who have the textbook, please mention the page number in the chat box. We'll start the session shortly. Just give me one moment. Chapter name and page number in the chat box of new textbook. Page number 143, chapter 8, nutritional and food requirements for expectant mothers. So first, the physiological changes during pregnancy. In which every system in a woman's body undergoes a lot of change, okay? Like, for example, the uterus, before she gets pregnant, it's hardly 100 grams in weight. But by the last trimester, okay, 9 months and 10 days, just the weight of the uterus is around 1 kg or more, okay, 1 kilogram or more. So that is the immense amount of change that comes into a woman's body when she is pregnant. Okay, a lot of changes. Okay, so uterus is just one part of it. Every system in a woman's body undergoes tremendous amount of change when it comes to pregnancy. Okay, so one by one we'll just see that. When it comes to the blood profile, blood chemistry, okay, there is a big demand of blood cells. It could be RBC or by WBC, white blood cells, red blood cells, platelets. Okay, each type of blood cells will increase because the blood volume has increased. Okay, earlier, let's say if the blood volume was just 2.5 liters or 3 liters. Okay, during pregnancy, the blood volume doubles. Okay, the woman will have more than 4 to 5 liters of blood in her body. Okay, so a lot of blood volume increase will be there. There is too much of water in the blood. Okay, so it should not dilute the blood in any case. Okay, so the total blood volume increases. Along with the blood volume, the cells that comprise the blood, that should also increase. Okay, cardiovascular system, the woman may undergo tachycardia. Tachycardia means increased heartbeat because the cardiac output is increasing. Now the heart has to pump double the amount of blood, double the volume of blood heart has to pump. So obviously the heartbeat will be raised up. That is tachycardia. Okay. Increased heartbeat per minute. Okay. Normal heartbeats per minute is between 60 to 100. Okay. In pregnancy, it is more than 100. That is tachycardia. Okay. Increased cardiac output. Cardiac output means the amount of blood your heart is able to pump out. With each contraction, how much blood your heart is able to pump out. That is cardiac output. So that is also increased because the blood volume has increased. Okay. Increased stroke volume, that is blood volume. Okay. The volume of the blood has increased. Coming to the respiratory system. Now the uterus is growing upwards and forwards. Okay. The uterus is growing upwards and forwards. So whatever organs are there just above the uterus, that includes your intestine, stomach, kidneys, okay, everything will be pushed up, okay, while the with the growth of the fetus along with the uterus. Uterus is a completely muscular hollow organ, okay. So when it grows, it will push everything to one side. It's usually upwards. So all the abdominal organs are hitting the diaphragm. Diaphragm is a muscle that separates your chest cavity and your abdominal cavity. Diaphragm is a muscle that separates your thoracic and abdominal cavity. That is your chest region and your abdominal region. Okay. So diaphragm gets the push of it, push of the growing fetus. And diaphragm also pushes upwards. So it compresses the lungs. Okay. So there is a displacement of diaphragm that is taking place. Superiorly means on the upper side, upwards. Okay. Increased functional reserve capacity, that sorry, decreased functional reserve capacity, that is a reserve uh, oxygen that the lungs is able to retain back some oxygen, that will be decreased. Okay, lungs are not able to retain oxygen, so that's why the woman will hyperventilate. Okay, she goes breathless. Even if she do some minor exercises, she will undergo breathlessness. Okay. That is the respiratory change. Hyperventilation, breathing pattern will change. Okay, lung volume will change to meet the demand of the mother and the fetus. Okay, now the lung has to work for the mother as well as the growing fetus. So the lung volume will also change. There will be a lot of edema in the airway. Okay, swelling in the trachea. Diaphragm is lifted by around 4 centimeter. Okay, by the end of the pregnancy, by the third trimester, end of the trimester, diaphragm shifts at least 4 centimeter upwards from its normal position. Okay. Chest circumference will also increase. Okay, because now the lungs want more space, so the rib cage will expand. The chest circumference will also increase. Increase in oxygen consumption by at least 30%. Okay, more intake of oxygen because now the lung volume has increased, lungs have expanded. There is a push from the diaphragm from downwards. Okay, lungs are getting the push beneath. Okay, So something has to happen to the lung so that it can accommodate the increasing demand of the pregnancy, okay, keeping up with the push that comes from below. Okay, so the lung will expand. So that is why the chest circumference will increase. Okay. Then you have the gastrointestinal changes, that is your abdominal. Okay. There is increased nausea, vomiting, okay, that morning sickness that happens. Usually by the end of first trimester, morning sickness should subside. Okay, nausea and vomiting should just disappear by the first trimester. But if it exists, okay, even in the second trimester, if the woman is vomiting, feeling nauseated and all, okay, she has to take medications for it. Okay, heartburn and acidity will be there. Just imagine, uterus is growing. Okay, it is pushing all the internal organs upwards. Stomach is getting compressed. Okay, so definitely the hydrochloric acid which is inside the stomach, that will spill out. Okay, when the stomach is getting pushed from down, the stomach contents will come into the esophagus. So that's why they get a lot of acidity. So that is what causes a lot of heartburn, acidity. Gastric pressure is also increased. Okay, and there is high chances of gastroesophageal GERD. Okay, gastroesophageal reflex, that as I mentioned, when something goes into the stomach, but the uterus is pushing the stomach upwards. Okay, there are high chances that whatever the mother has eaten, it will spill backwards. Okay, so that leads to the reflux syndrome, GERD. And by 16th week of pregnancy, morning sickness should subside. Okay, by the end of first trimester, sickness should end. Okay, if it persists, then you have to get medically corrected. Okay, because that could lead to malnutrition. If the mother is not able to keep something in her stomach, it could lead to malnutrition. The reason of morning sickness and nausea is not completely clear. It's usually understood that you have a lot of hormonal changes. Okay, progesterone levels, gonadotropin levels. Okay, the muscles of the stomach is smoothened, so it is not that hard, and it is not able to contract properly to keep the food inside. Okay, the muscle of the stomach will also relax, it will smoothen out. That is the reason why nausea takes place. General changes, there will be change in mood, behavior, mood swings. Okay, increased nutritional demands. She will feel like she has to eat something, like she may undergo pica. Okay, some, if any micro mineral deficiency is there, she will feel like eating chalk, wet sand. Okay, unnatural things. Okay, a woman may feel like she wants to eat some unnatural thing. Okay, immunity, there are other areas also in a woman's body, like her renal system. Okay, since there is a high demand on heart, there will be an equal high demand on kidneys as well. Okay, kidneys size will also increase because now the blood volume has increased. Kidneys have to work overtime to filter out this increased blood. Okay, so kidney size will also increase. The GFR rate also increases. So frequently she will have to go and urinate. Creatine levels, protein excretion, glucose excretion. Okay, these levels will increase. There is high chances of sodium retention. Okay, she will retain a lot of sodium, because of which swelling will be there. Skin also, they have not mentioned much about skin on in this chart, but even skin changes will be there. Pigmentation, okay, darkening of the nipple areas in the breast. Okay, nipple size will increase. Even the color of the vagina, the vulva, that will change. Facial pigmentation will take place. Okay, stretch marks will start. Linea nigra, that is a straight dark line. Okay, uh, till the umbilicals. Okay, that will start from the pelvis to the umbilical. That will emerge. That is linea nigra. That will happen. Okay, so these are striae gravidum. That is stretch marks. Okay, so these all skin changes will also be seen. Immunity usually goes down. Okay, in pregnancy, immunity of a woman usually is suppressed a little bit, because you don't want a woman's body to reject the growing fetus. Okay, so there is a slight risk of developing certain infections, influenza, pneumonia. Okay, these infection risks are there with pregnant women because her immunity is suppressed a little bit. Okay, because the body should not reject the growing fetus. So these are some of the physiological changes during pregnancy. Is it clear to all? Next is role of placenta. So placenta is the organ that supports the entire pregnancy. Okay, during pregnancy, placenta is connected to the baby, okay, through the umbilical cord, and through that the child gets oxygen and nutrients, and also whatever excreta the child is producing, the fetal urine and all, that also gets excreted from the through the placenta. So it's the mode of exchange. Okay, placenta is the area which helps in the exchange of gases and nutrients and the excretion between the mother and the child. Okay, it's a temporary organ. Placenta is an organ, it's a temporary organ. It has to be removed when the child comes out. Placenta will be removed. Okay, with contractions itself, placenta should also come out, otherwise it can be manually removed by a gynecologist. It is attached to the uterine wall. You can see here how the placenta is. Okay, this is the ideal place for the placenta to be attached to the upper part of the uterus wall, the fundus of the uterus. Okay, this is this entire red area which you can see, the red the border, that is the uterus. Okay, and placenta should be ideally in this upper part of the uterus, ideally at the fundus of the uterus. In some situations, high risk pregnancies, if the placenta is pretty low, okay, near the head of the child or very close to the cervix, it is high risk pregnancy because the placenta may burst open during the when the mother undergoes labor. The placenta may burst open, and that could lead to hemorrhage, bleeding, and death of the child or mother. Okay, so the way how placenta is formed during the pregnancy is important. Okay, the placenta, it is usually formed where the egg, fertilized egg zygote attaches itself. That is the area where the placenta will be formed usually. So it provides the baby with oxygen, nutrients. It removes all the harmful waste and carbon dioxide out of the from the baby. It also produces hormones, okay, to help your child to grow. Placenta produces that hormones, and it also passes immunity from the mother to the child through blood, and it protects the baby. Okay, for the survival of the fetus, placenta is important. So role of a mother's habits during pregnancy. Okay, if a mother is smoking, or she has some or the other form of substance abuse or drug abuse, okay, the ill effects of those behavior, not just the mother will suffer from, but also the fetus that she is carrying, and also the the next generation, that is the unmatured unmatured um, either ovum or sperm that the fetus will be carrying, that is a fetus's generation. Okay, they will, three generations will also get affected. Okay, the reproductive cells that are even as when you are growing as a fetus within the mother's womb. Okay, along with the fetus's body, reproductive organs, reproductive cells of the fetus are also growing. Okay, so any behaviors, okay, any harmful behaviors like substance abuses, smoking and all, the mother, her own generation is getting affected, the next generation, that is her fetus, second generation, and also the third generation, that is the reproductive cells present in the fetus, they are also getting affected. Okay, so just like smoking, nutrition also plays an important role in which like if you are sitting right now, the health of your grandmother when she was carrying your parents, okay, that is also important for the health and the disease conditions that you may carry right now. Okay, the kind of life your grandmothers had, both maternal and paternal grandmothers had while she was pregnant with your parents. Okay, that health is also important for the third generation's well-being. Okay. Next important topic is preconceptual nutrition, which means a woman is not pregnant yet. Okay, she is just planning to get pregnant in the coming year or within the coming few months. Okay, um, she is planning to get pregnant. Okay, so that in those time period, okay, what is her nutritional status is important. That is what we call as preconception nutrition. Okay, that is pregnancy diet, before pregnancy. So before a woman gets pregnant, her body has to be ready to accept the pregnancy. Okay, she has to be strong enough to continue the pregnancy. Otherwise, if the preconceptual nutrition is not that good, there are high risk of miscarriages, spontaneous abortions, stillbirth, complicated pregnancy. These things can happen if the preconceptual nutrition is not good enough. Okay. In India, we have a cutoff range, that is 40 kg. Any woman who is less than 40 kg, she has to gain weight to become a to get pregnant. Okay, mothers who are weighing less than 40 kg, it is seen that 99% of the times, women who weigh less than 40 kg have given birth to low birth weight babies or small for gestational age babies. Okay, premature babies. So these complications in pregnancy are very common if mothers are malnourished or if they are less than 40 kg. So cutoff weight is 40. At least you should be 40 to 45 kg to maintain a healthy pregnancy in India. In different countries, this statistics will change. Okay. And also preconceptual nutrition, it is also linked to your fertility. Okay, healthy food, healthy nutrition is directly linked to your fertility for both men and women. It's not just for women, for men as well. There are certain food like, let's say, oysters. Okay, seafood, oyster, it has high levels of zinc. Okay, and it is good for a man's fertility. Okay, it helps in semen fertility, to contribute to semen health, testosterone production in men. Okay, and also ovulation and fertility in women. Oysters are good for a man's as well as a female's fertility. Small for gestational age, SGA means small for gestational age. LBW means low birth weight babies. So at least 15 gram of, 15 microgram of zinc on a daily basis should be there to keep your reproductive health good for men and women both. Okay. Be in your RD of all vitamins and minerals. Do a complete nutritional panel test, okay, vitamin panel test with your blood. Okay, find out the deficiencies, correct your deficiencies, and then think of getting pregnant. So that is the ideal way to approach pregnancy. Folic acid is important. It is seen that a woman, okay, you can also answer this question if I raise the question. A woman who has corrected her folic acid deficiency before pregnancy, or a woman who has corrected her folic acid deficiency during pregnancy, who do you think will have a successful pregnancy, not uncomplicated normal pregnancy? Which one of them? The one who has corrected her folic acid, specifically folic acid deficiency. Okay, it is very important. Folic acid deficiencies during pregnancy could lead to neural tube defects in children. Neural tube defects means spina bifida, children who are born with microcephaly, that is small head, absence of skull, the top part of skull, okay, cleft lip, cleft palate. Okay, these are neural tube defects, very common in mothers who are deficient in folic acid. Okay, so we have to place a lot of importance in folic acid, iron, okay, at least 800 microgram of folic acid on a daily basis. Calcium, 1000 to 1200, that is the ideal range. Okay, 1000 to 1200 glass mg of calcium on a daily basis. Some supplements, vitamin supplements are also given. Nowadays, we have a complete WHO along with UNICEF. They have come with a complete set of multivitamin and mineral tablet that the pregnant woman has to take on a daily basis from day one of the pregnancy to the 9th month. Okay, it is any country can manufacture it. Okay, that multivitamin, any country can manufacture it, but the contents of that multivitamins will remain same throughout the world. Okay, so that is one multivitamin given by WHO, World Health Organization. Iron, magnesium, calcium, essential fatty acids like omega-3 fatty acids, these are important for a healthy pregnancy. Is it clear to all? Coming to nutritional requirements in pregnancy, there has been some changes, okay, based on the ICMR data. Every year, if you take, they have done, always they have some changes they have already done in the nutritional requirements, specifically when it comes to protein, energy, calcium, iron, okay, vitamin C. These areas of nutrition undergoes a lot of change when it comes to ICMR data. And also it is dependent on the activeness, the kind of lifestyle the pregnant woman has. Okay, is it sedentary, okay, not moderately active, okay, highly active, what kind of lifestyle she has, that is also considered while determining the RDA. Based on the data that international organizations like Food and Agricultural Organization in USA, World Health Organization, and UNU, okay, based on their expert committees, ICMR also changes its data on a regular basis. Okay. Next, coming to the energy requirement, you do not have to eat two meals for two people when you're pregnant. Usually they say you should eat for two when you're pregnant. It's not true. Okay. Energy, it is increased only after your second trimester. Okay. Slightly it will increase during the second trimester, and a little bit more energies will calorie will be increased during the third trimester. Okay. But it is never more than 300 kilocalories. Okay. You have to only eat an additional meal when the pregnancy was successful, you have given birth to a child, and you are lactating. Okay, when a mother is lactating, when it's a lactating woman, she has to have an additional meal itself. Okay, earlier if she was having just 3 meals a day, when she is lactating, she has to have 4 meals a day. Okay, when she is lactating, but even in pregnancy, the energy requirements are not that high. Okay, so that is a myth that you have to eat for two when you are pregnant. That only leads to obesity and other health issues. Okay, so don't indulge in overeating. Because the basal metabolic rate, okay, that also goes through a lot of ups and downs. Okay, so nowadays the energy requirement is low. Okay, earlier it was high. The old ICMR data, if you see, it was quite high, but now based on the recent data, it is just 3 to 8 kilocalories per kg per day. Okay, 3 to 8 kilocalories per kg per day. I have mentioned in the chat box. 3 to 4 calories will be for sedentary, a woman who is sedentary. Okay, 5 to 6 will be for a woman who is moderate, and 7 to 8 will be for a woman who is highly active. Okay, so based on the lifestyle a pregnant woman has. Okay, so just imagine a woman who is 60 kg. She has a moderate lifestyle, moderately active lifestyle. What would be the calorie that you will recommend? 60 kg is a woman's weight, and she has a moderately active lifestyle. So based on this range of calories that I have given you, take an average. 5 to 6 means you can take 5.5 kilocalories per kg. So maximum, she has to add only 330 kilocalories in her diet. Okay, maximum 330 kilocalories only she has to add in her diet, not more than that. Okay, so let's say a 60 kg woman was having a normal diet, a healthy balanced diet of around 1300 kilocalories. Okay, a 60 kg woman was having a normal diet of 1200 or 1300 kilocalories on a daily basis. Now that she is pregnant, by third trimester, she just have to increase 330 kilocalories. Okay, so around 1500 or 1600, not more than that. Is it clear how you have to check the calorie requirement? Next is the protein requirement. 55 gram of protein, it's a baseline. Every woman should have at least 55 gram of protein on a daily basis. But now that she is pregnant, okay, by third trimester, 55 gram, that baseline will stay like that itself, plus 23 grams, additional 23 grams. Okay, So total it will be around 78 grams. Just round off it as 80 grams of protein. 80 grams of protein per day. Or else you can, if you have to be very precise, it is just 0.83 grams of protein per kg per day. Okay, earlier it was 1 gram protein per kg per day for pregnancy, but now they have reduced it. Okay, but also remember, if you are a vegetarian, and if you have consume a lot of cereal and pulse based diet, then 1 gram of protein per kg per day is fine. You can follow that. But if you are a non-vegetarian, or if you're a lacto-ovo vegetarian, then 0.83 gram of protein per kg per day is sufficient. Okay, depends on the quality of the protein that you're having. If on a daily basis you are consuming high quality protein, that means on a daily basis you are consuming eggs, fish, milk, okay, 0.83 gram of protein per kg per day is sufficient. If you tend towards having low quality protein like cereal and pulse based protein only, then 1 gram of 1 gram per kg per day. Okay, the ICMR values that they have mentioned in the textbook, that will also change in the future. Okay, so don't worry about the ICMR values here. Okay, just understand what principles we have to apply here. Okay, you don't have to mug up the ICMR values because it will keep on changing. Now what you will try to memorize, tomorrow it will change. Okay, the ICMR 2024 data will be released, or 2026 data will be released. Again, some change in the values will be there. Okay, so there is no point in memorizing it. Okay, so just understand the baseline, how much more you have to add. That's it. Adding few calories extra, adding some protein extra will never go wrong, because there is a range. Okay, 330 calories today, what we have calculated, even in 2026 it will never become 500 kilocalories. It will be around 300, 350. That's it. It will be in that range, but it will never go beyond 400 or 500. It will always be in that range. Okay, slight difference in the range will be there in the ICMR values, but it will not be a drastic difference. Okay, so the protein part, is it clear to all? If you have a cereal based diet or a low quality protein diet, in times of, if you are vegan or vegetarian, okay, if the protein quality is low, 1 gram of protein on a daily basis, you can calculate like that. But if you are a non-vegetarian, you are having eggs, milk, fish and all on a daily basis, 0.83 grams of protein on a daily basis is fine, because you are getting complete protein. Okay, complete protein is checked off. Visible fat, do not go more than 30 gram. Okay, 20, not more than 30 gram still for active person. But if you are sedentary or moderately active person, don't go more than 25 to 27. Upper limit should be 27 gram. That is your cooking oil, ghee, butter that you use to cook your food. That is completely under your control. How much you have to pour into your vessel, cooking vessel, that is in your control. It should not be more than 27 grams. Okay, don't go more than 30 grams. 30 gram is the upper limit. Okay. So if you take adequate amount of whole nuts, okay, if you're eating seeds like pumpkin seeds, watermelon seeds, sunflower seeds, okay, almonds, cashew nuts, ground nuts, if these things are a part of your diet, you are having a handful of these seeds and nuts on a daily basis, keep it to 25 gram of fat on a daily basis. Okay, because especially almonds, cashew nuts, okay, ground nuts, they are rich in fat, healthy fats. Okay. So you have to limit your visible fat somewhere. And make sure you are taking essential fatty acids as well, omega-3. 25 gram will be equal to 25 ml. Approximately it will be equal to 25 ml. Okay, you can check online how much is 30 gram. 30 gram is equal to how much ml. Calcium, uh, calcium data, it fluctuates frequently. Okay. Sometimes it will say, some international organizations will say you should have 1000 mg. Indian organizations will say you should have 1200 microgram. Okay. So calcium, uh, this calcium mineral range always fluctuates. Okay. But the bottom line about calcium is that at least have 1 liter of milk. Okay. Milk or any dairy products. If you're lactating, 1 liter. If you're pregnant, at least half a liter to 600 ml. Half a liter to 600 ml, that is 500 to 600 ml of dairy products. Any form of dairy products should be there in your diet. Either milk, buttermilk, curd, yogurt. Okay. So based on the recent data, it is 1200 microgram per day for pregnant women. You can check the table in the textbook. If required, it is completely based on your choice of food. Okay. There are foods that are rich in calcium, like if you are a non-vegetarian, fishes like sardines, mackerels, they are calcium rich. Sesame seeds, chia seeds, they are calcium rich. Okay. Ragi is also calcium rich millet. So based on your food choices, if you are sufficiently able to meet the calcium requirements without supplements, without the help of supplements, then it is fine. Otherwise, if your food choice, if you're not a person who eats ragi, okay, if you do not like sesame seeds, okay, your food choices does not accommodate calcium rich food, then you will require supplements. Okay. If you're taking 1 liter of milk, it's completely fine. You are meeting the calcium requirement. You don't have to worry about calcium then. 1 liter of milk on a daily basis, if you're taking, no worries of calcium. Okay. It does not mean you have to take 1 liter of milk. Half a liter of milk you can take, half a liter of buttermilk or curd. Okay. You can divide it based on the three meals. Then iron requirement is 35 microgram, and some sources say it is 27 microgram. You can check in your textbook what they have mentioned. It is 27 microgram. So they have reduced the iron requirement. Earlier it was 35, but now it is 27 microgram per day for pregnant women. So this requirement can be fulfilled only with iron tablets. Okay. You have to take iron tablets. Folic acid supplements will be given. Folic acid and ferrous sulfate supplement will be given. You have to take it. Okay. Normal woman, it will be 29 because normal woman is menstruating. Okay. A normal woman, if she is not like a non-pregnant woman, she is menstruating. So she is losing, she has higher chance of losing iron. Okay. Pregnant woman is not menstruating, but her blood is getting diluted. Okay. Blood volume has increased, right? So the blood is getting diluted. Normal woman, definitely she will have to take a little bit more iron. Okay. Her iron requirements are high because she is menstruating. There is a monthly loss in iron. Okay. In pregnant women, not just after pregnancy, even after 6 months. Okay. After pregnancy, till her exclusive breastfeeding is done, she will not menstruate. Okay. Even after pregnancy, for the when she's exclusively breastfeeding, okay, some women, they will not menstruate, and they will not ovulate as well. Okay. So when there is no iron loss, you don't have to have more iron. You just have to maintain your iron levels taking the iron supplements. Okay. Sodium, no need to take extra sodium. If you suffer from pregnancy induced hypertension, then use low sodium salt. Okay, low sodium salt is available. You can use that. But you don't have to take extra sodium. Okay, whatever your meal gives you, whatever amount of sodium the meal gives you, normal meal gives you, that is enough. Iodine, 100, just additional 25 microgram. But when you're adding that extra 330 calories, automatically that extra 25 microgram of iodine, you will recover it from somewhere. Okay. Zinc, 12 microgram on a daily basis. Avoid deficiency of zinc. It is important. Then vitamin A, 6,400 microgram. Eat at least one yellow, orange, or red fruit or vegetable on a daily basis. If you're a vegetarian, if you're non-vegetarian, if you eat liver, organ meat, okay, it will be sufficient to meet your vitamin A requirements. Okay. Vitamin D is highly essential for the mother's bone formation as well, to continue the pregnancy, and also the fetal skeletal development as well. Vitamin D is very important. So don't be deficient in this. Vitamin D supplements, if it is required, has to be taken. Okay. Spend some time in sun. Vitamin E deficiency is very rare because when you're using vegetable oils, seed oils, okay, polyunsaturated fatty acids, you will get, okay, sunflower oil, mustard seed oil, safflower oil, whichever seed oils you are using, it will give you polyunsaturated fatty acid. Okay, use vegetable oils, you will get your vitamin E. Water soluble vitamins, you can check that table. Vitamin C and thiamine, riboflavin, niacin, all your vitamin B complexes, they have mentioned in table 8.1. Page number you can mention in the chat box. Then vitamin C, additional 40 microgram. Okay, so almost approximately around 80 to 100 microgram of vitamin C on a daily basis you have to take. Okay, almost 100. Okay, stay about 90 or 100 will be there. So at least two fruits on a daily basis, 2 to 3 fruits, fresh fruits on a daily basis. So coming to the next topic, that is relationship between maternal and fetal nutrition. If mother has inadequate food intake, if she is not taking enough food, she will slip into malnutrition, maternal malnutrition. And when mother is suffering from malnutrition, her blood volume decreases, her cardiac output increases. Okay, cardiac output will increase when you are pregnant. Okay, certain hormones also make your heart beat at a higher rate with greater pressure. So cardiac output will increase, but uh, blood volume will be less. Okay, because of malnutrition, mother does not make enough blood, and nutritional supply for the fetus will be decreased. Okay, because of mother's malnutrition, and thus placental size. Okay, placenta also needs nutrition to grow, to keep growing along with the fetus. Placenta also keeps growing. Okay, so the size of the placenta decreases, and the child's growth will also decrease. If the placental size decreases, there is not enough surface area in the placenta for the exchange of nutrients and gases. So automatically the child will suffer with growth retardation. Okay, so that is the pathophysiology of maternal malnutrition and fetal growth retardation. Is it clear to all? It's simple. Inadequate food intake in mother, from mother's part, she will suffer from malnutrition, less blood, more cardiac output, not enough nutritious blood that reaches the placenta. Okay, placenta cannot grow. If placenta cannot grow, child will also not grow. Okay, it's a very simple pathophysiology. Okay. Coming to the food requirements, certain guidelines, okay, on how the pregnancy has to be maintained. All the basic 5 food groups. Can you name the 5 food groups in the chat box? What are the 5 food groups? No, these are nutrients. These are not food groups. Carbs, proteins, fat, okay, they are not food. They are nutrients. They are macronutrients and micronutrients. Vitamins and minerals are micros. Cereals, carbohydrates, pulses, fats, they are macros. They are not food. They are nutrients. Okay. Cereals, pulses, vegetables, fruits, dairy products, meat products, oil. Okay. They all come under the 5 food groups. Okay. Cereals and pulse. Rice is a food. Wheat is a food. Meat, dairy, milk, eggs, fruit, vegetable, they all are food. So they are food groups. Okay. So all the 5 basic food groups should be included in a mother's diet, in a balanced diet. A balanced diet will automatically have these 5 food groups. Okay. So don't get confused between nutrition and food. Okay. Nutrition is the micro level. You can't see nutrition. Okay. You can't see nutrition, but you can see the food. You can see rice, you can see wheat, but you can't see omega-3 fatty acids. You can't see vitamin A, vitamin C. These things you can't visualize with your eyes. Okay, that's nutrition. Then at least 3 cups of milk or equivalent. 1 cup, according to ICMR, 1 cup is around 200 ml. Okay, don't forget that. According to ICMR in India, what we measure, 1 cup is 200 ml. I have mentioned in the chat box. Okay, whatever bowl or cup that gives you 200 ml, of fluid is considered as 1 cup. Okay. So 200 ml of milk means, three cups of milk means approximately 600 ml of milk, at least a little bit more than half a liter of milk. Okay. So that much milk, or equivalent means, if you don't like milk, if you are going through your morning sickness and you hate milk, go for the substitute of milk. Okay. That is, you can go for soy milk. Okay. Soy milk is also a complete protein. You can go for curd, buttermilk. Okay. Any equivalent of milk you can use here, but at least 3 cups of it should be there in your daily diet. 2 servings of meat, fish, poultry, eggs are a good protein source, good quality protein source. If you are a vegetarian or a vegan, it should be a good quality protein source of 2 servings on a daily basis. Okay. If you don't want to gain a lot of weight, you can use tofu, you can use soybean. Okay, these things you can use. Legumes. Okay, sprouted legumes are good protein sources. Paneer is a good protein source, but it also comes with fat. Okay, it has more fat as compared to tofu. If you take 100 grams of tofu, 100 grams of paneer, paneer has high fat content. Okay, tofu has good protein equivalent to paneer, but it has less fat. Okay, so you can make a choice here. But if you're a non-vegetarian, lacto-ovo-vegetarian, include egg on a daily basis. Okay, lacto-ovo-vegetarians include milk and egg on a daily basis. Pescatarians have fish daily, fish curries. Okay, dark green and yellow vegetables, so that your vitamin A requirements will be fulfilled. Okay. Generous servings of citrus fruits. Don't mix the fruits together. Okay. One family of fruit you can eat together, but don't mix 2 different families of fruit together. Okay. For example, don't eat apples and oranges together. They are completely 2 different species. Okay. In the fruit family. Okay. Apples and pears you can eat together. Apple and pear. Okay. That you can eat together. They are from the same family. Green apples, red apples, pears. Okay. Orange, Mosambik, those kind of fruits, citrus fruits, they are in the same family, that you can eat together. Okay. Small frequent meals, so that acidity is not an issue. If you overeat, if the mother overeats, there are high chances that she will suffer from acidity, heartburn, okay, nausea, vomiting. Okay, so eat small and frequent meals. Weight gain should not be more than 400 gram per week. It is very crucial. Okay. And if the woman is already obese or overweight when she started the pregnancy, weight gain should be less than this. Okay. 300 grams or 350 grams of weight gain on a daily base, on a weekly basis is permitted. Okay. But if she is an average build, okay, with a normal BMI, when she started the pregnancy, 400 gram per week weight gain is ideal. Plenty of water to prevent dehydration. Limit caffeine to 2 cups. Based on the ICMR data, you are not supposed to drink caffeinated drinks. Okay, coffee and tea is not allowed during pregnancy, but you can limit it. Okay, you should not have high caffeinated coffees like espresso and all. Okay, that has to be avoided. Sugar substitutes should be used in moderation. We would not suggest stevia or any form of monk fruit or any form of artificial sweetness during pregnancy, because the long-term effect on it, on mother and the growing fetus, we do not have researches supporting the use of artificial sweeteners. Okay. If the mother is suffering from gestational diabetes, she has to take medication for it, and she has to reduce her simple carbohydrate intake. Okay. Sugar also comes under it. So you have to control it. but we would not suggest any form of natural sweeteners or artificial sweeteners substituting sugar. Okay. 20 grams of sugar at max, 20 to 25 grams of sugar maximum you can consume, not more than that. That is the cutoff limit given by World Health Organization. Okay. A healthy human being who is not diabetic can consume 20 to 25 gram of sugar on a daily basis. Is all the food requirements clear? Is it clear to all? Balanced diet should be here. Okay, balanced diet, that is focus on balanced diet, protein rich food, grains, fruits, vegetables, eggs, legumes, dairy products. Focus and give a special focus on folic acid, iron, calcium, and protein. Folic acid, iron, calcium, protein. Crucial for pregnancy, okay, and development of baby. Fatty fishes are good. And there is a concept called 100 days of nutrition. In pediatric nutrition, 1,000 days of nutrition, not 100, 1,000 days of nutrition. This is a concept that we follow. It starts with your pregnancy. It will not end with the pregnancy. It will end only at during the second birthday of your child. Okay, because the mother is continuing her lactation till 2 years. You have to breastfeed your child. Okay, first 6 months is exclusively breastfeeding. Then 1.5 a year, weaning diet will be introduced. Child by the first birthday, by the child should have what the adults in the family is eating. Okay, so 100 days of nutrition, it includes your entire pregnancy plus the first birthday and the second birthday of the child. Okay, that is 100 days of nutrition for the woman. So she is not depriving her resources, her body resources, in feeding and rearing the child. Okay, that is the 1,000 days concept. And the target weight gain should be around 10 to 12 kg. Okay, overall 10 to 12 kg. When you gain 400 gram per week, okay, 10 to 12 kg of weight gain during pregnancy is considered normal. But those who are overweight, you have to gain less than between 5 to 9 kg. Okay. Just additional 330 or 350 kilocalories of energy from second to third trimester is enough, not more than that. Always remember that don't overeat. Overeating during pregnancy will lead to excessive weight gain. 20 ml of cooking oil, okay, that is enough. At least 40 gram of nuts, oil seeds. If you want these guidelines, just WhatsApp me. I will send you the link, okay. Pregnancy guidelines, just WhatsApp me pregnancy guidelines. I'll send you the link. Eat a lot of vitamin C rich fruits like gooseberries, amla, guava, orange. Lots of green leafy vegetables. And for vitamin D, expose yourself to sunlight for at least 15 minutes. Okay. Avoid smoking, alcoholism, tobacco chewing. Then general dietary problems that is seen in pregnancy, nausea and vomiting is very common. So when a mother is suffering from nausea and vomiting, she make sure that she has dry food, not liquid food. Okay, like if you give her any porridge kind of a food or soup kind of a food, fruit juices, smoothies, when she's undergoing nausea and vomiting, all these things will come out of her immediately. Okay. But if she's having some dry food, okay, like khakras, some glucose biscuits, okay, chapatis, dry chapatis without oil, with some dry sabzi, okay, when she's having this dry kind of food, there are less chances of nausea and vomiting. Okay, bringing all the food out. Okay, so have dry food, and don't do too much of seasoning with a pregnant woman's food. Some people, some women have aversions to seasoning. Okay, only during pregnancy she will have aversions to seasoning. So don't over season any food. Okay, limit the use of spices, because too much of spicy food, if the mother is undergoing morning sickness and if there is too much of spicy food, it will irritate her esophagus. Okay. Leg cramps, uh, especially night cramps, okay, muscle cramps at night, it will so make sure you are taking adequate calcium. Okay, start taking calcium supplements or start consuming more calcium rich food. You will see your leg cramps at night, especially at night, it will subside. Okay, if leg cramps are happening, there it's a high chance that a woman is suffering from calcium deficiency. Am I audible to all? So any pregnant woman who is suffering from a lot of leg cramps, okay, muscle contractions at night, start taking calcium supplements, okay, or start taking calcium rich food. It's because of calcium deficiency that you suffer from leg cramps during pregnancy, okay. Heartburn, avoid spicy food. Okay, do not lie down soon after having food. Okay, after having food, at least walk for 10 to 15 minutes, let the food settle it, and then sit somewhere at least for 2 to 3 hours after you have had your meal, not snack. Okay, after you have had your meal for at least 2 to 3 hours, don't go and lie down. Okay, so avoid some spicy food, drink plenty of water. Okay, and don't lie down immediately after food. Certain beliefs that can harm, yeah, for normal people also, leg cramps, it could be a sign of calcium deficiency. Okay, certain beliefs like having raw papaya, okay, having curd, having garlic, should not, pregnant women should not have these food. These all are certain belief systems. Okay, she should not eat any vegetable. Okay, she should only have uh, porridge rice or something. Every culture has their own beliefs that what a pregnant woman should have or should not have. Okay, to an extent you can follow this thing, but if it leads to malnutrition, a lot of food items from the food group system is been cancelled because of this belief system, then it is harmful. Okay. Some cravings and aversions. Okay, usually they crave for a lot of citrus food. It's because your body is asking for more vitamin C rich food. Okay, if you are nutritionally well, okay, if you do not have any macro or micronutrient deficiencies, you will not have much cravings during pregnancy. Okay, aversions, usually after pregnancy your aversions will subside. Okay, it's a very psychological reason for aversion. We do not know the exact cause of it, but during pregnancy, if you have some aversion towards certain smells, certain food, by the end of the pregnancy, once you have completed your pregnancy, all these aversions will subside. Okay, cravings are a sign that you have some or the other uh, micronutrient deficiency. Okay, if you're craving for something sweet, have more fiber rich food. It's because your gut bacteria is not getting enough food. Weight gain, as mentioned earlier, just 400 gram per week. Okay. The average weight gain should be between 10 to 12 kg for a healthy, well built woman. Okay. But if you are overweight or obese, Your weight gain during pregnancy should be between 5 kg to 9 kg, not more than that. Okay. Some women, they will try to lose weight during pregnancy so that they can have an easy pregnancy. Okay, so that the child is not heavy. If the child, they feel if the child is small, it will come out of the vagina very easily. Okay, so that you are putting your child's health and growth at risk. Okay, so such misconceptions have to be ruled out. Then pica is having a tendency or a craving of eating unnatural things. Okay, like ice, soap, wet soil, chalk, okay, chalk pieces, wood scrapes. Okay, you have an liking towards eating these unnatural things during pregnancy. It is usually linked with micronutrient deficiency. Okay, if you correct your micronutrient deficiency, the pica cravings will subside. Okay, is it clear to all? So complications in pregnancy, anemia is very common. You have to accept that. Okay, 99% of women during pregnancy, they are anemic, not because they are not producing enough RBC, it's because they have too much of blood. Blood volume has increased, the blood has become diluted, so obviously the blood cells will also become diluted. Okay, and what happens if based on the amount of plasma that you have, plasma is the liquid. Okay, the liquid form of blood, that plasma you have, and you have very less amount of blood cells, automatically you are anemic. Okay, so majority of the pregnant women will be anemic. Some mild form of anemia is very common in pregnancy. Okay, but you have to take your folic acid and ferrous sulfate tablets. FSNFA tablets has to be taken irrespective of having mild anemia or how normal anemia is. Irrespective of that, supplements has to be taken. Then constipation as a side effect of iron tablets. Okay, and also your gastric motility slows down because now your body has an increased requirement for nutrition. Okay, so your body will try to manage to pull out as much of possible nutrients from the food. Okay, and how it is possible? Only when the peristalsis movement slows down, only then your small intestine will have enough time to grab as much of nutrients as possible from the food for the growth and development and for the maintenance of the pregnancy. So if the peristalsis movement is slowing down, definitely you will suffer from constipation. Okay, so there are different factors that leads to constipation, not just one. Okay, so taking iron and folic acid tablets. Okay, meeting the physiological needs of pregnancy, peristalsis has to slow down, so constipation will happen. And also your intestines are getting pushed up. Okay, the normal alignment of your intestines are changing, so anatomically that will also lead to constipation. Okay, only if it is severe constipation, laxative will be taken. Otherwise, just consume lukewarm water with whatever food that you have. Okay, just consume a little bit of lukewarm water. Okay, your constipation should resolve. Okay, but expect some level of constipation during pregnancy. Laxative should be taken only if it is a severe form of constipation that is leading to bleeding or piles. Only in that case, take laxatives. Edema is also very common because of increased cardiac output, increased stroke volume. Okay, edema is very common. You just have to manage it. Okay, keep your legs elevated while you sleep. Okay, to remove the ankle edema, feet edema, which is very common during pregnancy. Okay, keep your legs in elevation. Don't stand for long hours. That could lead to varicose vein, because along with edema, if you're standing for long hours, that could lead to varicose vein. Okay, In pregnancy-induced hypertension, PIH, that is a situation where BP issues, okay, high blood pressure will begin with your pregnancy and also end with your pregnancy. Before pregnancy, after pregnancy, you have a completely normal blood pressure. But during pregnancy, you have extremely high blood pressure. Slightly blood pressure will increase with pregnancy, that is very common. But here, resting blood pressure will be more than 140, 150. Okay, so that is pregnancy-induced hypertension. So if any woman had pregnancy-induced hypertension during her pregnancy, there are high chances that as you approach your menopause, you will have some cardiovascular issues. Just like how gestational diabetes cases have high risk of developing diabetes, pregnancy-induced hypertension will also have high risk of developing cardiovascular diseases in the future. Okay. So medical management is done here, clinical management is done here. Avoid sodium-rich food, control the sodium intake. That's it. Hypertension is also common, control the sodium intake. Then gestational diabetes, control the simple carbohydrate intake. Don't indulge more in simple carbohydrates. Have more of foods that are low in glycemic index, low in glycemic load. Okay. Just like the normal diet, what a diabetic person will have, you have to follow the very same diet. Okay. And you can manage the gestational diabetes. Preeclampsia. So in preeclampsia, all these signs and symptoms will be there. Okay, it's a condition in which legs will have severe swelling. Okay, presence of protein in the urine, and high blood pressure, especially at the systolic blood pressure. That is when we say a normal blood pressure is around 120 by 80 mm of Hg. So this 120 is systolic, 80 diastolic. So 120, the first part of the BP, that is quite high. You may have a normal diastolic pressure, but your, your systolic blood pressure is very high. Okay. So when you have these three symptoms existing together, then the mother is suffering from preeclampsia. Okay. Swelling, protein in urine, and high blood pressure. Okay, these three symptoms are there, means the mother is diagnosed with preeclampsia. She has to be very careful. Okay, if she does not take good care of her health, it will lead to eclampsia. And this is eclampsia. Again, it has the same symptoms. High blood pressure, edema is there. Okay, protein in urea, edema in the leg, pitting edema in the leg, which means the swelling when you press it, okay, there is a hole that will be, there's a depression that takes place. Wherever you have pressed using your fingers, that area will be depressed. It will take time to come up. That is pitting edema. Okay, that is there. But what is the difference between eclampsia and preeclampsia? Here in eclampsia, the mother suffers from seizures, convulsion. Okay, she will suffer from fits, convulsions. So it is complete bed rest. Okay, from the time she is diagnosed with preeclampsia, she will be on complete bed rest until her labor. Okay, so these are high risk pregnancies. Okay, from pregnancy induced hypertension onwards, it's high risk pregnancy. Exercises during pregnancy, aerobic exercise, you can indulge in high aerobic exercise, but do not indulge in heavy exercises. Okay, don't indulge in weightlifting. Okay, like basketball, contact sports, avoid it, like basketball, football. Hot yoga means you perform yoga in a hot chamber like room. Okay, where it is you are supposed to sweat a lot while doing yoga. That is hot yoga. Okay, avoid it because that would the mother may faint and her blood pressure is already high, so you have to avoid such situations. Skiing, horseback riding, ice hockey, boxing, these contact sports has to be avoided. Okay, you can do brisk walking exercises, Kegel exercises. Okay, Kegel exercises is to strengthen your pelvic floor so that you will have a normal vaginal delivery. Okay, swimming, stationary bicycling, that is, don't take a cycle out and go for cycling. stationary bicycling, you are in one place. The cycles that we use in gym, okay, yoga, jogging, dancing, these things can be performed. These are safe exercises for pregnancy. In first trimester, you are not supposed to do any aggressive exercise, okay, because there are high chances of miscarriage, okay. Then Indian pregnant woman, based on the ICDS care plan, okay, antenatal care is given free of cost, okay, from government health departments, primary healthcare centers, community healthcare centers. Antenatal care is given free of cost. All the antenatal checkups, okay, medications, supplements, supplemental nutrition is also given. Weight monitoring is done in the PHCs, okay, that is she gaining enough weight or not. TT is a vaccine that you have to get during pregnancy. TT immunization has to be taken. Then iron and folic acid supplementation during pregnancy is given. Health education, not just the pregnancy nutrition, but also lactation nutrition, and also the child's nutritional education. Once, even if she's pregnant, give the nutritional importance for rearing the child up to the age of 5. Up till the age of 5, what all care the mother has to take for the nutrition, for her own nutrition, and also her child's nutrition up to the age of 5, that education has to be given when she is pregnant. Okay, that's a target population. Food supplementation for selected criteria, that is some rural areas, okay, areas which have the highest risk of giving birth to low birth weight babies. Okay, certain states, certain districts where you see a pattern of a lot of small for gestational age and a lot of small low birth weight babies are being born. In those criteria, in those areas, food supplementation is given to pregnant women. Okay, it's usually sattu mavu combination and all. Okay, and whenever you find this is for the medical practitioners, based on the signs and symptoms, if you find a high risk pregnancy, she has to be referred to an obstetrician or any higher healthcare department, secondary or tertiary care hospitals. She has to be referred there as a high risk case. Mother and child protection card, the I card. Okay, every state has a different name for this. So mother and child protection card, the mother has to take care of it till the age 5. Okay, when the child is during her pregnancy, after pregnancy, till the 5th birthday of the child, she has to maintain this child protection card. Okay, under the age 5 card is also another name given to this card. Okay. Then we have Pradhan Mantri Matru Vandana Yojana. These in yojanas during pregnancy, during the labor time. If it is a girl child, okay, a cash is given around 5,000 to 7,000 rupees to the mother, and if it's a boy child, 4,000 rupees or 3,500 something. This amount is given to the mother for the maintenance of the labor. Okay. So that exact monetary valuation, I think it is given in the textbook. You can check that. So that's all for today's session. If you have any queries, you can mention in the chat.